In this video, we'll explore the vessels of the heart, including the coronary arteries, veins, and the lymphatic system, to understand how blood flows to, from, and within the heart. To do so, we will start by detailing the coronary arteries, followed by the cardiac veins, and the lymphatics of the heart. Some clinical notes, and finally a conclusion. Let's start with the coronary arteries. The arteries of the heart are called coronary arteries. We distinguish. The left or anterior coronary artery supplies most of the left ventricle and the interventricular septum. And the right or posterior coronary artery supplies most of the right ventricle, the interatrial septum, the entire right atrium, and part of the left atrium. The left coronary artery arises from the aorta, just above the left semilunar valve. It runs through the sulcus separating the pulmonary artery from the left atrium and the left auricle, reaching the upper end of the anterior interventricular sulcus. After a short course, it reaches the upper end of the anterior interventricular sulcus, where it divides into two terminal branches, the anterior interventricular artery and the circumflex artery. The left coronary artery gives off multiple branches, including vascular branches, the atrioventricular or circumflex artery, and the anterior interventricular artery. The vascular branches are intended for the adjacent walls of the aorta and the pulmonary artery. Among these branches, the left fatty artery stands out, which ramifies within the fatty layer located on the anterior surface of the pulmonary artery. The atrioventricular artery, or circumflex artery, runs horizontally to the left and enters the atrioventricular sulcus. It terminates either at the posterior end of the interventricular sulcus, where it anastomoses with the right coronary artery, or on the inferior surface of the heart. It gives off the anterior left atrial artery, which in turn gives off branches to the left auricle, left atrium, interatrial septum, and the supraomedial part of the right atrium. It supplies the Keith and Flack node, and the left marginal artery, which descends along the left surface of the ventricle, and the posterior left atrial artery, which distributes to the posterior surface of the left atrium, and the anterior interventricular artery, which travels along the anterior interventricular sulcus down to the apex of the heart, which it curves around to reach the posterior interventricular sulcus, where it anastomoses with the right coronary artery. It gives off ventricular arteries, where some extend to the right and left over the surface of the heart, then penetrate the ventricular wall at some distance from their origin. And others, known as anterior septal arteries or anterior arteries of the septum, enter the heart wall immediately at their origin and supply the anterior two-thirds of the interventricular septum. Let's move on to the right coronary artery. This artery arises above the middle part of the right semilunar valve. It runs back to front, between the pulmonary artery and the right auricle, then enters the right part of the atrioventricular sulcus. Upon reaching the posterior interventricular sulcus, it bends and continues along the sulcus, and ends at some distance from the apex of the heart. The right coronary artery gives off, near its origin, vascular branches, anterior atrial arteries, atrial and ventricular branches, and the posterior interventricular artery. Vascular branches are meant to the walls of the aorta and the pulmonary artery, among which is the right fatty artery. The anterior atrial arteries, where one of them, the largest, arises from the right coronary artery near its origin. It ascends and moves backward to enter the interatrial septum, and it supplies this septum and the posterior surface of the right atrium. The atrial and ventricular branches arise within the atrioventricular sulcus. Among the atrial branches, the right marginal atrial artery can be distinguished. The most important of the ventricular branches is known, due to its course, as the right marginal artery of the heart. And in the posterior interventricular sulcus, the right coronary artery becomes the posterior interventricular artery. It gives off ventricular branches to both ventricles and posterior septal arteries to the septum. The first septal branch supplies the Tawara node. The right coronary arteries and left coronary arteries are anastomosed in 50% of cases. These anastomoses are located in the interventricular septum, in the posterior interventricular and atrioventricular sulci, at the apex of the heart, and around the pulmonary artery. Let's explore now the cardiac veins. The venous system of the heart is very rich. The modes of drainage allow for the distinction of two groups of venous networks: the veins that open directly into the heart cavity, and the coronary venous network. The veins that open into the heart cavity are represented by the small cardiac veins or accessory cardiac veins, and the Thebasian veins. The small cardiac veins or accessory cardiac veins arise from the anterior and right part of the right ventricle. They open directly into the right atrium above the atrioventricular sulcus through openings called foramina. The most important of these veins is the right marginal vein of the heart, or the vein of Galen, which runs along the lateral border of the right ventricle and opens into the right atrium, at the base of the auricle. Whilst the Thebasian veins is a name given to small venules that originate from the walls of the heart. They open into adjacent cavities through small openings or foramina of Lanelong. The Thebasian veins are found in the walls of the atria and in the papillary muscles of the ventricles. The coronary venous network is made of the great coronary vein and the coronary sinus. The great coronary vein begins at the apex of the heart. It runs along the anterior interventricular sulcus up to its upper end. It then curves to the left and enters the atrioventricular sulcus, traveling along this sulcus until it reaches the area near the inferior surface of the right atrium, where it terminates. At its termination, the great coronary vein suddenly increases in caliber. This terminal venous conduit, dilated and 3 cm in length, is called the coronary sinus. The coronary sinus is equipped with the Thebasian valve at its auricular opening, and also has a second valve at its origin, at the junction with the coronary vein, known as the Vieussens valve. This crescent-shaped valve is located on the anterior surface of the venous trunk. The coronary sinus receives the posterior vein of the left ventricle, the great vein of the heart, the oblique vein of the left atrium, the middle vein of the heart, and the small coronary vein. Let's delve now into the lymphatics of the heart. The surface of the heart is covered by a subpericardial lymphatic network, into which the networks of the myocardium and endocardium drain through the periarterial collectors. From the subepicardial lymphatic network, 2 main collecting trunks arise, one on the left and one on the right. The left anterior main collecting trunk drains the left part of the network. It ascends, passing around the left side, then the posterior surface of the pulmonary artery, and terminates in an intertracheobronchial lymph node. Meanwhile, the right main collecting trunk is located in the right part of the network. It follows the right coronary artery in the atrioventricular sulcus, then ascends along the anterior surface of the aorta, along the interaortic pulmonary sulcus, and terminates in a precervical lymph node of the anterior mediastinal chain. With this in mind, let's discuss some clinical notes and applications. Starting with atherosclerosis. Atherosclerosis is a condition where fatty deposits, called plaques, build up inside the arteries. Over time, this narrows the vessels, reduces blood flow, and increases the risk of heart attacks and strokes. It often develops silently and progresses slowly, making early detection essential. Coronary artery disease occurs when the coronary arteries become narrowed or blocked, usually by atherosclerosis, reducing blood flow to the heart muscle. And a myocardial infarction, commonly known as a heart attack, happens when a coronary artery becomes suddenly blocked. This cuts off oxygen supply to part of the heart muscle, causing the tissue to become damaged or die. Immediate treatment is vital to limit the extent of the injury. To conclude, the vessels of the heart include the coronary arteries, which supply blood to the heart muscle, and the cardiac veins, which return it to the right atrium. A lymphatic network also drains excess fluid, helping to maintain tissue balance.